So we know very clearly in medicine that your metabolic health is the context by which we should evaluate the risk of your LDL load. But doctors don't do that. So we're flying blind. We're only using half the variables that we should be using. There's no contextualizing because Western medicine isn't good at contextual nuance at all. We just want to say, you have high LDL. We know that in a population, if we give you a statin, and I'll talk about statins in a moment, we will slightly reduce your risk, especially if you've had a heart attack. If you haven't had a heart attack, there's not a lot of great data for statins in primary prevention. But so Western medicine is not good at individualizing care for humans. They're okay at looking at a population swath, but for anyone who's listening to this podcast or thinking about these things with nuance or making intentional decisions with regard to their food and lifestyle, Western medicine is not really going to serve you with the level of clarity and specificity that you really need. And so they're not even going to check what her insulin sensitivity is. They're not going to say, you're metabolically healthy. And if we look at the data, someone who's metabolically healthy with your level of LDL actually doesn't have an increased risk of heart disease. So why would we give you a statin, which we know interrupts the synthesis of cholesterol in the human body and has tons of side effects? Because when we're interrupting the synthesis of cholesterol, we're also interrupting the synthesis of coenzyme Q10, which is a key part of an electron transport chain, which is how all the energy in the body gets processed and translated into useful currencies, ATP and things like that. So many people who take statins get muscle aches because we've abrogated, we've basically stopped their production of critical nutrients that are in the same pathway as cholesterol. And so Western medicine says, oh, it's okay, we'll just give you more coenzyme Q10. Well, what about the squalene or these other, nutrients that the human body is making in the cholesterol pathway? We're not supplementing all of those. And how bioavailable is this coenzyme Q10 that they're giving you? And if a doctor gives you coenzyme Q10 when you have muscle aches on a statin, that's a very astute physician in the first place. Most of them will just say, stay on the statin. The most important thing is that I don't get sued for you getting a heart attack with this LDL. So it's a very complex situation, but let's just back up again and really kind of summarize what we're dealing with here. I don't worry about LDL if someone is insulin sensitive. In a diabetic, do I worry about LDL? Yeah, but fix the insulin sensitivity, right? I'm not. The LDL, I think there's a lot of good evidence that we really need to have these discussions among physicians and question the dogma with regard to LDL. I think just knee-jerk responses saying your LDL is high, you need a statin is not the whole picture. You have to understand the context of that. And then we need to equip physicians with education that tells them this is how you help your patients reverse their insulin resistance. And we need to do research that actually creates some substance behind that recommendation.
So real quick, because someone who goes to their doctor and their doctor says, hey, you have high LDL, and they panic right away, right? And they're like, oh, they want me to get on a drug. And I can't possibly repeat everything that Dr. Saladino just said. And so I just throw up my hands. What is one or two sentences they can say to their doctor to say, I'm not that concerned about my high LDL because I'm not diabetic?
Did you check a fasting insulin? Can we evaluate my metabolic health? And if you just say, can we evaluate my metabolic health? The doctor will not know how to evaluate the metabolic health. So you may need to ask them to check a fasting insulin. And the last piece I'll add to this is that it's very clear in human physiology that in many humans, eating more saturated fat and less polyunsaturated fat raises the LDL slightly.
Right.
Slightly. 10%, 20%, which is why a lot of people eating in this way will go to their doctor and have a, quote, high LDL. The last time I checked my LDL, it was 130 milligrams per deciliter, which is just above the normal range, saying 120. But most doctors would say, you have a high LDL, you should eat less red meat.
And so just to summarize here with respect to LDL cholesterol, Dr. Paul Saladino is not that worried about LDL cholesterol. Some doctors are worried, and so then they recommend statins, which might be worrisome for many people because of the side effects. And speaking of not being sued, I should remark that nothing on this podcast is medical advice. And so please consult your doctor, your astrologist, your pet care facilities, and your yoga instructor before implementing anything into your life. Don't take responsibility for yourself. Please outsource it to everyone in your community because you're not responsible. Everyone else is responsible for your health.
Oh my goodness.